Hi, I'm David Isaac. I'm a GP on the Isle of Wight, and today we're going to talk about bowel cancer. We're going to divide the section into bits. We're going to talk about the key symptoms and signs. We're going to talk about making a diagnosis, and we're going to talk about our campaign for trying to improve the number of patients who are diagnosed at an early stage of bowel cancer. So first of all, some background information about bowel cancer. Bowel cancer is the fourth commonest cancer. There's about 44,000 cases a year, and it accounts for 16,000 deaths per year. So it's actually the second commonest cause of death from cancer, and it's second to lung cancer. It's slightly more common in men than women, and some peculiarities and special features which actually make it susceptible to improvement. Initially, it's actually quite slow growing. It has a precancerous stage, so bowel cancers form out of initially polyps, and polyps grow slowly for several years before they turn into cancer. Many cases occur in families, and in some cases there's a genetic predisposition. There's a special group of patients who have a condition called Lynch syndrome. Lynch syndrome is where you have a defect in DNA repair, and they account for lots of cases, particularly in bowel cancer that occurs in younger patients. It doesn't just affect the bowel, it affects other cancers as well, as you might expect with a DNA repair problem. And it's reckoned that there's probably about 100,000 families who are missing, who could be diagnosed with bowel cancer, who we hope to pick up across the country over time by analysing the tissue samples from bowel cancers and the other cancers that are detailed in the list. Bowel cancer, there isn't really any underlying cause or predisposition as there would be in maybe lung cancer with tobacco smoking. It's reckoned that about 54% of cases of bowel cancer are preventable, but they're caused by a variety of different causes. So it's thought that about 13% are caused by eating processed meats, about 11% are due to obesity and overweight, and about 28% of cases are caused by eating too little fibre. There are other causes such as smoking and not having enough physical activity, but the main ones are the early ones. There is recent research that there may be a cause of bowel cancer as being certain E. coli infections, which you get as a younger person, and that's ongoing research. So we need to know the signs and symptoms of bowel cancer. The important things are bleeding from your bottom and a change in your normal bowel habit. The change is generally to a slightly looser bowel habit, and it can be accompanied by losing weight. It can be accompanied by abdominal pain. It can be accompanied by actually feeling a lump in your tummy, and because of the fact that you lose blood from the bowel, you can become anemic, which would make you tired and feeling breathless. Sadly, only a small percentage of bowel cancers are diagnosed at stage 1 and 2. There's a slide which we're going to flash up. It shows only about 25% of bowel cancers are diagnosed at stage 1, and I've compared it with other cancers. So you'll see it's almost got the lowest number of cancers diagnosed at stage 1 compared with Hodgkin's lymphoma, which of course, as you know, is something which is generally treated well even at a late stage. And you compare it with uterine cancer, which is the second one from the right, when actually most patients are diagnosed at an early stage. Survival is really good if you diagnose it at an early stage, but not so good if you diagnose it at a late stage. So the next slide, which we're going to show you, shows the bars are the proportion of patients who are diagnosed at the stages. So the blue bar is diagnosed at stage 1, and the dark pink bar at the end is diagnosed at stage 4. And overlying that, there are some lines. The 3 lines represent 1 year, 5 year and 10 year survival. So you can see prognosis is pretty good really if you've got stage 1 and 2, but it falls off quite rapidly when you get to stage 3 and 4, which is why we're focusing on early diagnosis as being one of the ways of trying to improve outcomes. And as we've mentioned all the way through, early diagnosis is the key. So to do this, we have bowel cancer screening, and we need to really make sure that patients return their screening kits. We need to make sure that patients know what to look for, and we need to make use of FIT testing. FIT testing has revolutionised bowel cancer diagnosis. It's used in screening, and when we use it in screening, the threshold for FIT positive testing is 120. When we use it as for patients who've got symptoms, the threshold is much lower, it's set at 10. So we're going to talk about screening now. Screening's been present for a few years. We found that, I'm going to show you another slide in a moment, and you'll see that patients who are diagnosed at screening, 60% of them are diagnosed at stage 1 and 2, which means that they're easily treatable. If you compare that with the bottom of this slide, which shows patients who present in A&E who turn out to have bowel cancer, only about a very small percentage of those patients are diagnosed at stage 1 and 2. And if you look at GP 2-week Wight referrals, and which are renamed faster diagnosis referrals now, and GP routine referrals, they're somewhere in between those two extremes. The screening pathway is on the next slide. So the patients get sent a kit via the screening hub. They complete their screening kit. They poke a plastic probe into one of their poos, and then they send it by post back to the screening hub. The screening hub will look at the result, and if it's over 120, they'll invite them in for further investigations. And the further investigations is going to be a colonoscopy where they will look for polyps and bowel cancer. That screening continues for every 2 years. We need to compare that with patients who have symptoms. This is a different pathway. These are patients who you will be sending, you'll be giving a FIT test to in the surgery. You'll be sending the FIT test to your local lab. And with those patients, if the FIT test is over 10, you'll be referring them. If it's under 10, you'll be safety netting them, which means reviewing whether they still need a referral and reviewing whether perhaps you might need to do a second FIT test. They calculated the threshold for the FIT tests by finding out that there was a fairly linear relationship and between the level of the blood in the poo and the chance of having bowel cancer. So I'm going to show you another slide in a moment. If you look at 10 as a threshold, there's a 1% risk of ever having bowel cancer. If you look at 37, there's a 3% risk of having bowel cancer. And these are the calculations that they used to set the screening threshold at 10 for the patients who are symptomatic. And you will see that normally we'd be referring at a 3% risk of cancer using the faster diagnosis pathways. With this one, they built in a safety margin, which brings it down to a 1 in 100 if their bowel cancer hemoglobin test is less than 10. The people ask, what's the chances of missing a colorectal cancer with a FIT test? Well, it's actually extrapolates back from that slide. So if you've got one FIT test and it's under 10, you're going to be missing 1 in 100 patients. If you then do a second test a few weeks later, that goes down to 1 in 1,000. There's going to be some more studies on this, and there's a study being conducted by the British Society of Gastroenterology, which will probably report in the next couple of months. So our campaign as a result of that is to increase the number of patients that are diagnosed at an early stage, and we're going to try to do that by increasing the proportion of patients that actually return their FIT tests. We also want to do that by increasing patients' awareness of the symptoms of bowel cancer, and we want to know that the GPs are prepared for any of those patients asking for fit tests and asking to be assessed. So we've divided the campaign into phases. We've already done the first phase, which is to send a survey via Accurex, and we've been staggered by the number of responses. We've already had 4,000. The results of that are that actually we found that, perhaps not surprisingly, patients are not completely confident about what symptoms they should be presenting with. But we have had some positive things. Feel certainly, as they said in the survey, empowered to seek medical advice. The campaign, we hope, will interest and amuse everybody. Your loo could save you. Lift the lid on your health. These are some pictures which you might be seeing similar things popping up around, so keep a lookout for them. And our campaign's going to take the form of various adverts. We're going to do posters and flyers. We're going to do interviews, toilet talk. We are going to have an events program, and we're going to target the workforce, and the campaign will run from May through to November. So what can you do to help? Well, it'd be helpful if you can ensure that those patients that contact your surgery with symptoms have an easy time, so that they're seen quickly and referred quickly. We need to ensure that patients of any age who you're worried about need to be assessed. So there's been an increase in bowel cancer in patients who are under 50, and that's been increasing across the West over the last few years. We're going to have information which you can display in your surgery, and we hope that you'll be able to support our campaign by raising awareness. So thank you for listening, and I hope that you'll be able to support our campaign.